Katie. I'm your student nurse today. I'm going to be doing an assessment on your neuro system. Do you have any concerns?
No.
Okay, so I'm doing my hand hygiene, patient has privacy, and can you tell me your full name and date of birth?
I'm Tanea Bolden, and then March 19th, 1996.
Thanks. Alright, so patient's capillary refill is less than 3 seconds bilaterally. Patient's skin is warm, dry, smooth, soft. The color is appropriate for her ethnicity. Can you tell me why you're here?
Just for a checkup.
And do you know where you are?
The doctor's office.
And can you tell me what day of week it is?
It is a Sunday.
And do you know who our president is?
Yes, find it.
Okay. So patient is ANO times 4. So now I'm going to start by assessing her cranial nerve 1, which is the olfactory nerve. So I'm going to place something underneath your nose while you close your eyes, and you're going to tell me what you smell.
It smells cinnamony.
Okay. So cranial nerve 1 is intact. Now I'm going to be testing cranial nerve 2, which is the optic nerve. We're going to start by doing the Snellen test. So go ahead and stand 20 feet away.
Okay.
You're going to cover one eye and try to read line 9, and then you're going to do the same with the other eye.
Okay. L-E-F-O-D-P-C-T.
Okay, and then the other eye.
L-E-F-O-D-P-C-T.
Okay. So patient has 20/20 vision. And now I'm going to be testing her peripheral field with the confrontation test. So I'm going to sit down. I'm putting a towel down on the patient's bed. Okay, so you're going to cover one eye.
Okay.
And then you're going to tell me when you can't see my finger anymore when I move it out, okay?
Okay.
Okay, so let's start here.
Can't see it.
Okay,
Can't see it.
okay,
Can't see it.
okay, and then the other one.
Can't see it.
Okay,
Can't see it. Can't see it.
okay. So, her peripheral vision is good. Her cranial nerve 2 is intact. Okay, so now I'm going to be testing her cranial nerves 3, 4, and 6, which are the oculomotor, the trochlear, and the abducent. Okay, so I'm going to start with Perla. Oops. I'm going to be testing the patient's pupil size, the shape, if they're equal, and the light reaction and accommodation. Okay. Okay, and then go ahead and follow this. I'm going to bring it closer to your face. Just follow with your eyes. Okay. Alright, ready?
Yes.
Okay. So patient is Perla. Her pupils went from a 4 millimeter to a 3 millimeter. And now I'm going to do the 6 cardinal gazes. So you're going to just follow this with both of your eyes, okay? Wherever I move it. Okay. So patient's eye movement was equal. Her eyes and her eyebrows are symmetrical. She can open and close her eyes effortlessly. There's no like eyelid droop. And the pupils react equally. They have a round shape. Yeah, so cranial nerves 3, 4, and 6 are intact. Okay, so now I'm going to be testing cranial nerve 11, which is the spinal accessory. And I'm going to be doing this by looking at her sternomastoid and trapezoid muscles. Okay. So her sternomastoid and her trapezoid muscles are symmetrical. And now I'm going to be testing movements against resistance. So go ahead and like put your shoulders forward, okay, and then go backwards, and then like shrug up, and then like roll your shoulders forward, and then roll your shoulders backwards. Good. Okay. So cranial nerve 11 is intact. Oh my gosh. Okay, so now I'm going to do cranial nerve 12, which is the hypoglossal. So can you go ahead and stick out your tongue for me, please? Great. So tongue is midline. And now can you say light, tight, dynamite?
Light, tight, dynamite.
Okay. I think you have to say it 3 times. Can you go ahead and say it 3 times?
Light, tight, dynamite. Light, tight, dynamite. Light, tight, dynamite.
Okay, so the cranial nerve 12 is intact. Tongue is at the midline, and her speech is clear. Now I'm going to be testing cranial nerve 5, which is the trigeminal. Okay, so, gosh, I'm like out of breath. Okay, so I'm going to be testing her like jaw when she opens and closes it. Yeah, okay. So go ahead and like open. Okay, and then like clench your teeth. Okay, and then I'm gonna try to open your mouth, but like don't let me.
Okay.
Okay, good. Okay, and then can you close your eyes? And I'm gonna touch your face with this.
Okay.
And you're gonna tell me when you feel it, okay?
Okay.
Okay, close your eyes. Okay.
Feel it. Feel it. Feel it. Feel it. I feel it.
Okay. Okay, so cranial nerve 5 is intact. So now
Sorry.
so now I'm going to be testing cranial nerve 7, which is the facial nerve. Okay, so her face is symmetric. Movements are symmetric. Can you smile and then frown and then close your eyes and lift your eyebrows? Good. And show your teeth to me, please. And then can you puff your cheeks?
Like your eyes closed.
No, it's fine.
Okay. And puff my
Puff.
teeth.
Yeah, okay. So movements are symmetrical. She's able to do all of the movements. So cranial nerve 5 is intact. Cranial nerve 7, 7 is intact. Okay, so now we're going to be doing cranial nerve 8, which is the acoustic. And, okay, so I'm going to stand behind you.
Okay.
And you're going to tell me if you can, you're going to like tell me what I say. I'm going to whisper something behind you.
Okay. Do I stand up or do I sit?
You can sit down, that's fine. Okay.
1, 2, 3.
Okay. So cranial nerve 8 is intact. Okay, so now I'm going to be testing cranial nerve 9 and 10, and those are the glossopharyngeal and the vagus nerves. Okay, so I'm gonna look in your mouth, and you're gonna open your mouth and say ah.
Ah.
Do it again.
Ah.
Okay. So her soft palate and her what's that thing called? No, uvula. Is that what it's called? The uvula rise midline and yeah, cranial nerve 9 and 10 are intact. Okay, so now I'm going to move on to the motor system. So I'm going to start with your muscles. So can you like roll up your, I see your muscles. If I need to both, I can compare them. Okay, so her muscles look symmetric in her upper extremities and also her lower extremities. Can you go and stand up? Yes, so muscles look symmetric in upper and lower extremities. And then you can go and sit down.
Yeah, but I should work
Yeah.
on it.
Okay, so now I'm gonna just squeeze my hands. Good. Okay, so hand grips are a 5 out of 5 bilaterally. And now I'm going to be looking at how you walk. Okay, so go ahead and stand up. I can't really get this in the video, or yeah, I guess I can. Okay. Okay, go ahead and walk. Okay, good. You can sit down. Okay. Okay, so patient's gait is steady. She's able to walk in a straight line. It's smooth. Her arms swing while she's walking. Oh, and her step is like 15 inches, like heel to heel. Okay, and now you're going to walk like heel to toe, like this.
Okay.
Yep, go ahead. Okay, good.
Gotta go back or no?
Sure. Okay, so patient is able to remain her balance, walking heel to toe, and she was walking straight. Okay, so now I'm going to do the wrong group test. So go ahead and stand up.
Okay.
So face that way. Okay, so close your eyes, have your feet together, your hands at your sides, and you're gonna stand like this for 20 seconds. Okay, you can sit down. Was that the right test?
Yes,
Yeah. Okay, yeah. So patient was able to remain her balance, doing the Romberg test for 20 seconds. So she has a negative Romberg. Okay, and now we're going to do, we're gonna do the posterior drift. Okay, so go ahead and stand up. And you're going to put your arms out. And, I think you have to close your eyes. Yeah, close your eyes. And then keep them up for 20 seconds. Okay, that's 20 seconds. Okay, so there's a negative posterior drift. Okay, so now you're gonna squat. Okay, so you can just do like 3 squats.
Oh God. 1.
Good.
2. 3.
Okay, good. So patient was able to squat and remain her balance. Okay, so now we're going to be doing the rapid altering movements. Okay, so what you're gonna do is you're gonna like squat and you're gonna like go like this.
Okay.
And then you're gonna like clap fast. And yeah, we'll just start with that.
So Squat.
So, yeah, so squat down and then like do like, yeah.
And then I go
Okay,
fast.
and then like clap as fast as you can. Good. Yeah, that's good. Okay, and then now you do, okay, so what you do is you like slide your foot like up your shin
Okay.
like this. Okay, good. And then do your other side.
Okay.
Okay. And now oh, you're gonna touch my finger as I move it around, okay?
Touch it?
Yeah.
Okay.
So can I go?
Okay.
See? I don't really know.
So,
I think you're just supposed to like, I don't know. Just touch it. Like, yeah. Good. Okay. And now what you're gonna do is you're gonna touch my finger like that, but then touch your nose like in between.
Okay.
Okay. Okay, good. Okay, so rapid altering movements are intact for this patient. She was able to do them all without any difficulty. Okay, so now we're going to be doing the sensory system. Oh, fuck, this video's long. Okay, so I'm going to be using a paper clip. Can you roll your sleeves up?
yes.
Okay, so I'm going to poke this, and I'm either going to do like one poke or two pokes, and you're going to tell me which one it is while you close your eyes.
Okay.
Okay? So I'm going to do it.
Sorry.
And then I think I can actually do it through your pants actually.
Okay.
Okay.
1, 2, 1, 1.
And then maybe your legs.
2, 2, 1, 2.
Okay. Okay, so she's able to distinguish between 1 and 2 pokes. Okay, so now we're going to be doing the pain. So you're either going to tell me if it's like a sharp or a soft object, okay?
I close my eyes.
Yes, close your eyes. Okay.
Soft. Sharp. Soft. Sharp. Soft. Sharp. 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 Soft.
Okay. So patient was able to distinguish between soft and sharp for most of them except for one. Okay, so now I'm going to be doing oh gosh. Extinction. So you're gonna close your eyes again,
Okay.
and then you're gonna point to where you're touched.
Okay.
Okay?
Throw rolls back up.
Yeah, that's fine. Okay. And I used 2 points at the same time. So she was able to locate where she was touched. And now we're going to do the same thing, but I'm not going to do like 2.
Okay.
Yeah. Okay. And patient was able to locate where she was touched when I was using 1 point. Okay, so now I'm going to do the tactile discrimination, which is like a light touch. So I'm going to use this cotton thing to touch you, and you are going to like say now when I touch you.
Okay.
Okay?
Now. 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 Now.
Okay. So patient was able to feel the light touches with the Q-tip. Oh gosh. Okay, so now we're going to do the vibration. So I'm using a vibration fork on her bony prominences, and you're gonna tell me like when you feel the vibration in like your bone start and stop.
Okay.
Okay. Okay. So I'm gonna be doing her ankle, her shin, her knee, and her iliac crest. I think that's it.
Okay.
Okay. Oh, and her wrist and her shoulders for her upper body. Okay, ready? Does that hurt?
No.
Okay.
Doesn't hurt.
Okay. Start and stop.
Start. Stop.
Okay.
Start. Stop.
Go to stand up. Okay. I'm gonna feel your hip bones.
Yeah, over here.
Where? Right here.
Yeah. Start. Stop.
Okay. Wrist.
Start. Stop.
And then shoulder.
Start. Stop.
Okay. Okay, so the patient was able to feel the vibrations. Oh, I need to do your other side, I'm sorry.
Okay.
Sit down for the lower legs.
Okay. Start.
Does that hurt?
No.
Okay.
Stop. Start. Stop. Start. Stop.
Okay, nice. So,
Okay.
your head.
Start. Stop.
And your wrist.
Start.
Doesn't
Stop.
matter. Okay, your shoulder.
Start. Stop.
Okay. So she was able to feel the vibrations bilaterally. Okay, and now we're going to do the gasphasia, I think it's called. So go ahead and stand up. So I'm gonna draw a letter on your back, and you're gonna tell me what letter or number it is.
Okay.
Okay.
T. K.
Mm-hmm.
Z.
That's kind of weird. Hold on, let me do this again.
An H.
Yeah. Okay, go ahead, sit down. Okay, so patient was able to identify the letters and numbers. So she's negative for the gasphasia. I think it's called gasphasia. Okay, so now I'm going to be doing the posterior column tract. So you're going to we take off your slippers. Okay, so you're going to flex your foot up and then down. So she's doing the posterior, dorsiflex and plantar flex, and then flex like your toes up and then down. Good. Okay. Patient was able to do the body positions, the dorsiflex, plantar flex, and it was equal bilaterally. Okay. And now I'm going to be testing your reflexes, so like your knees, and then I'm also going to do your elbows. Okay. What's this? Okay, so her feet are dangling. Okay.
Yeah, don't kill me. Just kidding.
I'll try to do it like light.
Okay.
Okay. Okay. So patient's reflexes at her patella are a 2+ bilaterally. Okay, so now stand up.
Okay.
So you're gonna like hang your arm like this. This is like your funny bone, so it might feel weird. Okay. Okay, so the patient's tri-tep reflexes were 2+ bilaterally. All right, thank you for letting me be part of your care.
You're welcome. Thank you.